Following completion of his DC degree, he relocated to the Pacific Northwest and began practicing chiropractic in the greater Seattle metropolitan region. He's gone on to establish a chain of chiropractic clinics in the region, serving as the Chief Executive Officer of Clear Chiropractic. In the course of establishing his chiropractic offices and wellness center network, he focused on employer groups who were struggling with escalating healthcare claims costs. This outreach allowed Dr. White the opportunity to extend the success he was having with his patients in private practice into hundreds of programs created for local employer groups around the Puget Sound. The next step in his evolution involved Darren founding Worksite Wellness, a full-service employee wellness company with a mission to create happy, healthy, and productive workforces. He presently serves as CEO of Worksite Wellness and has successfully taken this approach to many organizations, including 4 Fortune 100 companies, and provides services to well over 250,000 patients and their dependents. Would you welcome to the program this afternoon from Kirkland, Washington, Dr. Darren White. Darren? Thank you. Appreciate it.
Well, thank you so much for the wonderful introduction. I hope I can live up to a little bit of it. Over the course of the last couple days, we've been focusing a lot at the very high level, understanding of where we're at with healthcare. We've tossed around some different models and concepts, and I'd like to take the conversation from a very high level today down to maybe sort of the ground level where we can sort of understand some practical things that we can take away from the conversation this weekend. I titled the talk, Interrupting the Conversation. I feel like maybe there's 2 conversations that we want to interrupt. One is we definitely need to be in this healthcare reform conversation. And we definitely need to have our voice inside of the Affordable Care Act. The second conversation, which I'm going to finish my talk on, is a conversation that exists at the ground level. So it exists at the patient level, at the employee level, human to human, or maybe it's digital to human, as Dr. Beazold and I were just talking about. But I feel like there's 2 big interruptions we need to make. And with any strife we're seeing inside of this healthcare conversation, there's huge opportunities for us, and I want to kind of help us understand what those look like. I love the title, Reimagining Healthcare. I thought it was a great word considering a lot of the conversation has been around reorganizing, reforming, moving things around, shifting the game a little bit in hopes that we can make some sort of difference. I love the Winston Churchill quote, and I believe it fully, and I believe that for us to make a big difference, we have to think this thing from the other side of the coin. And I'm hoping that some of the things we discussed today and some of the things we share with you inside of what we've learned inside the employer market proves that point. How many were here yesterday when Dr. D. Eddington spoke? Great. For me, and I'm tingling right now because I felt like he's been my hero for about the last 3 or 4 years. I'm a bit schizophrenic, so I operate in 2 worlds. I'm a chiropractor. I think I was born a chiropractor. I'm educated a chiropractor, practiced a chiropractor. But I exist in another world, in the employer world, as a chiropractor and as a health management entrepreneur. And inside that world, as we're going to see, these escalating healthcare costs are crippling employer groups. Dr. Eddington, over the last 30 years, has been studying these trends, and he's figured out a way to identify certain risk factors, 10 specifically, inside a population and predict, within a few bucks, how much you're going to cost our healthcare system over time. And it was really cool for him to sort of get up and say, after 30 years, we got to do something a little different. And his message was what he's going to spend the next 15 years trying to prove, which is the message we've talked about for over 100 years, which is we got to keep people healthy. Then, right after Dr. Ed, for me that was a huge affirmation. And I felt like it just inspired me so much that I know we're going on the right path. I know we're doing the right things for someone of his caliber, his level of education, his level of data analytics to affirm that. Right after him, Andy Weber got on the stage and talked about how these crippling healthcare costs are affecting the employer specifically. And I'm going to take you into some stats and help you understand what those are like. And then from Andy Weber, I want to jump to Deborah Sen. So this morning she helped understand a few slides and a few glimpses of how maybe chiropractic has this huge effect from a cost containment standpoint through different treatment models. And then that was backed up again by Laura, and we heard it again at the very end today. So this reimagining healthcare, I feel like was the perfect word. The shell game. I learned this game from Don Klum. He's not here right now. And it's the game where he was a cup game back then. So you move the cup and the marble shoots around from side to side and you try to figure out where that marble is. Tuition at that time was, I think, $2,500 a quarter. And I'm not sure if I lost more money to Don teaching me that game or to my tuition. But nonetheless, I had a wake-up moment about 2 years ago. And we're in an interesting spot because I'm a chiropractor. I take care of patients. I'm also an employer, so I have staff that need health care benefits. And I'm also married, and I have a family that needs health care benefits. And so one morning, our broker came to us and wanted to share the new numbers, of which I'm usually just sign off and take the hike, and that's just the way it is. But this time was a little different. I found out that my employer, so these are the premiums I needed to pay the insurance company, for my employees went up 18%. That's a lot of money. Not but 3 hours later, came back from lunch, received a fax from Aetna, and found out that I was actually going to be paid 12% less per visit. 2 weeks later, I get my little card in the mail. You know, the little health card that you take to the hospital or wherever you go? Up 30% on my copay. And then I found out my my deductible, the amount that I have to pay first, increased by 100%. These are maybe some big changes, but when you add up these big changes, they are enormous changes in the overall effect. And so for me, I was like, wow, they're really throwing a ton of money at this and getting it from every different way, and we're making no progress whatsoever. In fact, we're getting worse, and some would estimate that it's unsustainable. There's another story not being told, and that is that chiropractors and other allied vitalistic health professionals are silently transforming outcomes, and unfortunately, they don't even know it. And I want to share that story today because I feel like it'll be a ground that we can build upon and make that story known and hopefully change policy a little bit quicker than the 17 years I was listening to this morning. Don't need to talk about this slide a whole lot. It's been hammered quite a bit. But like I said, we're going to move from 50,000 feet down to the ground. And this context is sort of important, but we won't spend a lot of time here. So the United States spends $2.5 trillion on medical care. That's $8,000 per person, and that's 50% more than any other country. And we all know the rest of the stats, right? Where we are in healthcare, medical errors, third leading cause of death. We've heard it. We've been there, got it. We understand the effect that has on the individual American. So one stat, just to remind us, is 50% of bankruptcy is due to illnesses. They can't pay their medical bills. Uninsured or not enough coverage, for whatever reason, they end up bankrupt. Not to mention, where do most Americans learn about healthcare for the first time? Earlier yesterday, somebody was talking, it was actually Dr. Eddington, talked about health literacy. And I was thinking, where do we get that? Is that in school? Where do we first learn about health? We have a healthcare class, and our healthcare class is teaching people how to buy a doctor. That's actually what we do at our healthcare class. But I'm realizing that conversation is not happening anywhere else. I'm realizing that it's actually happening more so on commercials. So pharmaceutical commercials are telling us what is real health and what is not. That's our first interaction before you end up sick and then you enter the system. So we have a lot of people that are quite lost. We have a lot of people that are learning about it from TV, from commercials, from different economic interests. And I think they sometimes show up at their primary care and know about a certain drug before even the doctor does. This is what I want to talk about here, is our opportunity inside of the employer market. So there's a lot on this slide. First thing we want to know is that 37% of our total healthcare costs are being footed by the employer market. So that's not the government, it's not your parents, it's the employer market, 37%. And when we look inside of the employer health spend, we notice that over the last decade, we see a 159% increase in our premiums. So you remember my 20% or 18% that I was all freaked out about. I mean, there's been 160% over the last decade. Now think about your chiropractic office for a second, or any other business for that matter. If you had an escalating expense on your balance sheet going out of control like this, what do? You don't just let it go. I mean, you can't. So the government can let it go for so long, and we can borrow from China to pay for that, but I can't borrow from China. I can't even borrow from the United States. I'm Canadian or English or... my wife was reminding me that I couldn't get a bank account. So 37% of our healthcare costs are being paid for, footed by employers, and employers are having this escalating cost. That's only half the story. Loss of productivity and performance from healthcare costs are 2 to 4 times the actual healthcare costs. So quantifying that, Gallup did a poll. Loss of productivity is $153 billion of lost productivity. Bureau of Labor Statistics, impact of poor health on businesses, $1.8 trillion. So you were upset about the health spend and the 160% increase. But what about the loss of productivity that's happening on the other side of the coin? And just to put it in, kind of a real-life story, type 2 diabetes, so this is again from D. Eddington. He can pretty much predict how much you're going to impact our health system by risks. He'll tell you that type 2 diabetic is going to cost about $3,000, $3,263 per employee per year. It's a lot. If we had a 10% incident rate inside of a 2,000 life company, so 2,000 employee company, it's a $650,000 a year expense. It's a lot of money. So the point here is that this is unsustainable. The opportunity here is that businesses are pretty smart. And we are super resilient. We're going to figure out how to solve this problem. And I'm going to share with you some examples of really cool ways that businesses are solving this problem. And I'm hoping that inside of those solutions, this is going to affect the conversation in healthcare. I actually had to refit my suit to get those pecs underneath. So from that, we have a war on healthcare, and it's all the P's. So we're hitting this war on many fronts, from policy, payers, providers, places, people. Right? So policy, we've talked a lot about this weekend, and I'm going to just give us some highlights and then some gifts out of that. Payers, so these are insurance companies. They can't sustain it. Providers, people like you and I. Places, this is the employment place. And lastly, people. They're all fighting the same war, almost the same way, with very little effect. And inside the employer market, I want to show some gleaming highlights. So policy, we talked a lot about value-based design, and the outcomes conversation comes up where we're trying to figure out how we actually fit into that. I mean, as a vitalist, if we're trying to keep people healthy or allow their body to adapt to their environment at a higher rate, what's that as an outcome? How do we measure that? And then how do we translate that conversation into policy? Patient-centered medical home, electronic healthcare records. And this was not talked about this weekend, which I thought was really surprising, so I'm going to spend a few minutes on this topic. But there is in law right now, so under ERISA, the opportunity for an employer to discriminate your health premium, meaning the amount of money out of your paycheck per month for your health care, based on healthy standards. Those healthy standards could be things like cholesterol, it could be things like glucose, it could be smoking. I forget who, I think it was Andy Weber mentioned there's certain companies, if you smoke, you can't work there. It's discrimination, right? So there are laws inside of ERISA that allow us to do that. And a couple real gleaming opportunities. Safeway, has anybody heard of the Safeway model? Yep. Yep. It would fall under BMI maybe. So you can, so for example, Safeway, I'm trying to think of their 4 factors. They have 4 factors, BMI being one, smoking, I think it's blood pressure and glucose. So you have to have those 4 factors in the green to get the proper amount of, the most amount for your dollar for premium. By law, you can, under this law ERISA, you can discriminate up to 20% of the premium, or up to 20% of your total health care costs. In 2014, so this is a trend now, we can actually go to 30%. It's kind of an interesting conversation that I'm surprised we haven't touched on, because it is trending that way. What is that a lot like? Well, it's not any different than driving your car, rolling through 5 stop signs. Never done that. And getting re-rated and having a higher premium because you have unhealthy behavior in a car. You're a risk to our society, more predictably going to get in an accident, hurt somebody, and cost us money, and we totally accept that, right? We totally accept that. Inside the health model, not so many of us accept that right away, but I just want to remind everybody that's a law. We can actually do that. Lots of companies are doing it. Safeway is the most notable. Whole Foods is doing it. So it's interesting. Payers. So these are things, so the people that are paying the bill, third parties, HMO, PPO, FSA, HRA, HSA. So just a different way, a different model of affecting people, which is interesting because I think it was Andy said this yesterday as well. If you move from the left to the right, you get closer to the patient. So inside of a health savings account, you're no longer just walking into the doctor's office and leaving. You now have to actually swipe a card. And if you swipe that card and the money from your employer goes to that provider. But if you don't swipe that card, it goes in your pocket. And we're seeing huge changes there. So again, just a little clue about, as we get closer to the consumer, how it can affect overall costs. We've seen payers and insurance get together inside a co-op. So Group Health, I'm from Seattle. Group Health is a great case study. I believe they had one of the very first patient-centered medical homes. And I believe a lot of what happened there is actually what we're talking about today. We can play around with incentive design. So Dr. Clem told me yesterday we can solve all this by removing the copay for the chiropractor and increasing the copay for the orthopedist. And so just by shifting incentives around, we can direct where people enter the system. Places, so companies, they build trust. So I'm going to talk about a trust in a second, a great example of our story being told inside of a trust. For those who don't know what a trust is, this is where we rate you based on a certain demographic rather than the whole population. So for example, my friend is in a SaaS, software as a service company, and they have a trust. And it turns out that if you are in a startup and you're creating a software as a service, that those rates are really, really low because it's a bunch of young coders sitting at a desk during the day and skateboarding at night, and apparently they don't have a big, huge liability on our healthcare. So that's being rated, re-rated inside a different population. Self Insured, that's actually going to be the end of this, so we'll talk about that in a minute. Providers are doing things like concierge medicine. There's a group in Seattle called Q-Liance, which are totally redefining this space. I actually wanted to talk to Deborah Sen about this and if chiropractic could ever provide something along that lines. But that's some pretty interesting. So it's sort of a fixed fee that you pay every month to the clinic, and then you have unlimited access to your provider. And their whole business model is, hey, if I keep you out of my office, then I can have more members and more time on the golf course. So it switches the economic scale where they're now incentivized to keep you healthy. And lastly, people, we see this, with the stats about how many people are seeing alternative providers are escalating because people are just tired. They're tired of hearing the same thing. And so these are all the different battles that are being waged right now against this problem. Lots of different people, lots of different policies with very, very little effect. This is the Wellness Trust. So there's a group, there's a broker in Seattle, and very forward-thinking guy. He was probably one of the very first guys on the wellness scene, and he decided that, hey, if railroad workers and software as a service and educators could be inside of a trust, why couldn't well people be inside of a trust? Right? So why not, if I exhibit certain healthy behaviors or I do certain things that are measurable, why can't I get a discount on my premiums? And so he started, I'm not sure if it's the first, but one of very few wellness trusts in the Seattle area. And when he goes to an employer, he simply says, we're going to measure everybody year one. That's your baseline. We know that if you do certain things, that you'll be healthier from an actuarial standpoint. These things are a thing like a health risk assessment. This is what D. Eddington is the father of, right? So this is a bunch of questions that are sort of annoying, like, do you smoke? Do you drive fast? Do you speed? Do you wear a seatbelt? Do you floss your teeth? The second thing you got to do is you have to get a biometric test. You don't have to have good results in your biometric test or even in your HRA. You just got to do these things. It's all participation-based. And so biometrics, standard panel, HDL, LDL, glucose, blood pressure, BMI. Third thing you got to do is you have to complete 6 calls with a health coach based on the assessment of biometrics. So that's a telephonic call, maybe every other week. Before last, activity device, so I'm wearing a lot of them, both on either foot right now. And in fact, if I walk the stage, I'm getting points, and my boss is depositing dollars right now into my HSA account because I'm doing activity. And so that's an incentive that we're playing with. And it's wireless, so as soon as I walk into the office, that data gets offloaded, goes straight into my well-being account, and then my boss sends me some money in my HSA account. And the program must have an incentive. So it's pretty simple. You just say to a company, hey, let's do these 4 or 5 things, and I'm going to give you, and they're averaging a 15% discount on premiums right now. So they're proving that and this is just participation. You don't even have to have good blood to get the 15%. So I think we're proving awareness. Drucker, what gets managed gets measured. What gets measured gets managed, I'm sorry. We're proving that just the fact that we're measuring it, just the fact that we have awareness is changing the equation. We're not even doing anything yet. And so this was my aha moment. I didn't even know what self-insured meant, but it's a great concept. So self-insured means that much like the Wellness Trust decided to re-rate populations of people based on certain factors, they get a rating in the healthcare system that's more attached to their real level of risk. So inside the self-insured model, the company takes on that role. So if you have, in Worksite Wellness, we have 15 full-time employees. And so what that means is we would, instead of hiring an insurance company to take care of my employees and pay those premiums, what I would do instead is I would just keep those premiums. I would just, my bank is my bank. And when you go to the hospital, I'm just going to write the hospital a check. So in a 15-person company, that's like you're thinking you're crazy. You would never do that. And you're right, you wouldn't. But when you get up to 2,000 employees in a company, and you're paying $500 to $800 for premiums every single month, you start to rethink that equation. Is anybody doing the math? It's a lot of money. And so suddenly you can't wait to write the $101 check for the annual physical, and so on. And so what happens is the employer themselves become the insurance plan. Why would they do that? Well, they get to be in control, right? So they have this self-contained healthcare system in essence, and they can control influences. So we already know that just awareness changes the equation. What if we actually did some outreach, or we had some nurse lines or case managers? So instead of people running to the ER, which is a real huge spend on our claims, why don't they call a nurse line first? We can play around with plan design, co-pays. We have far more flexibility inside of that. We can attach people to health coaches. We can do wellness programs. We essentially get to contain our environment. And in the self-insured world, I know it's only 18% of all employers, but they're able to curb these costs and beat the trends. So for me, I got excited because talking to a company about moving from fully insured to self-insured might be a year conversation. You could probably do it in 6 months. Whereas changing some of these policies and things that we've been talking about this weekend, it takes forever. The other cool thing about inside the self-insured model is that, as I think it was, everybody talked about it, I think, yesterday, that healthcare is relatively a small piece of the economic picture. And so we learned that 40% of our costs come from actually socioeconomic factors, like income, education, and so on. 30% come from health behaviors, 20% from clinical care, 10% from your physical environment. Well, employers have an opportunity to address all of those determinants inside health. And so again, inside this contained capsule, they feel like they can insulate themselves from these escalating costs. So for the last 4 years, I've been in that world. 12 years technically, but inside the self-insured and understanding that model, 4 years. And there's a bit of a blueprint to this model. I want to share the blueprint as, so we understand how they're able to affect things inside this self-contained healthcare system. And there's some best practices up there. And what the conversation needs to go to is, what are some next practices that Dee was talking about, and how can we take what's happening, the win that's happening here, and project it. So what do we do inside this model? Think of it as 3 broad strokes. So employers, when they're self-containing, self-insuring, they want to measure their culture along the top. They'll do that a number of ways. One, we can take an assessment. So Dee Eddington has a health risk assessment. We sort of like what Healthy Ways did, right, where they partnered up with Gallup's Well-Being Index and are able to understand bigger, broader footprint. You can do biometric data, so we can understand what people's bloods, what's going on in the blood. We can look at claims data. Even though it's a historical projection, we can find out what are people doing. And so if you have high ER costs, or if you have high neonatal costs, then we can introduce programs to curb those costs. And lastly, we do a cultural assessment. This is a next step. And I think the employer market is really looking closely at this, and this is, of course, what Dee wants to prove over the next 15 years, is that it's really the culture. So you have to measure, real broad stroke along the top. Then secondly, you need to provide feedback loops. So we need a feedback loop, or we need to present the data back to the employee. We need to send it back to the employer and let them know where the overall health of their company is. And then we need to target those issues with things like devices that I'm wearing, data-driven challenges, webinars, workshops. Whatever we're seeing going on in the culture, we have all these different modalities that we can get at. Does it work? It does. So this is actually a roll-up study of about 12 other studies. And so when we look at these key business metrics like change in sick leave, we see a 25% decrease in sick leaves. We see 26% in healthcare costs. We see 40% decrease in workers' comp, and then another 24% in disability management costs. And so we end up with for every $1 invested in a wellness program, we're seeing $5.8 return on investment. That's sound money to the CFO, who's really trying to make a decision about curbing these costs. And what I'm learning about this is only a fraction of what's possible, because we're still inside the old model, and I think we need to take it to the next level. So inside of wellness programs and health risk, oftentimes we're getting that 1 to 6 or 1 to 5 ROI, but our culture feels like this dude on the screen, right? So it doesn't feel good. You're alienating people. You're telling them they're bad, they're wrong, they need to fix it. And so even though our blueprint looked a little bit better and I talked about it a little bit nicer, at the end of the day, we're measuring you, we're telling you you're wrong, we're putting you in a box and then in a program, and then we hope we change the outcome. That's kind of what we're seeing. So Anybody read, I think it's this month's Harvard Business Review. There's the leadership lessons from Steve Jobs in great app form. It's perfect. One of his leadership lessons was the concept of leapfrog. And so when he built the iMac, the whole idea of the iMac was to share photos and to be able to have everything all in one place and be able to share it. And mostly it was around photos and files and so on. And what he forgot about at that moment was music. And so as he was rolling out the iMac, Microsoft or the other side of the fence were rolling out hardware and software where people were burning discs, right? So they were ripping music and burning music and sharing it. The iMac couldn't rip or burn a disc. And so he thought he'd lost. He thought he'd lost that. And instead, as you could imagine from his personality and his strive, he decided to take it to a whole new level and ended up, what did he roll out? iTunes and the iPod, which solved, right, how we buy and share music in one contained system, and we all know where that ended up. And so he literally didn't just look at the iMac and say, hell, we just need to put a CD burner in there and we'll get the market. He leapfrogged far ahead, and I feel like we're at that moment. So we can see that employers are stressed and they need to solve this. We've got a glimmer inside of the self-insured model and the wellness concept of small changes, but we've missed the boat. And our leapfrog comes from a conversation we need to have around supply versus demand. So if we go back several slides, and through all our conversations over the last few days, what have we talked about? We have talked all about supply. How are we going to better do it? How are we going to deliver it? How are we going to change it? How's Darren going to lose money in the shell game? It's just moving things around. And the conversation that we've been talking about for over 100 years, which is we need to get to the person. Steve Jobs did this. So Bill Gates said, I'm going to get businesses to buy computers, and then the consumers will buy second. And Steve Jobs went about it and said, no, we need to go after the consumer, and the businesses will adopt. And so he made electronics and geeky computers sexy. But if we want to, in my opinion, if we want to try and fix things by moving things around, it's like being on that cycle, trying to go down that road. It's just not relevant. And so if we can turn the game upside down and look at the demand side of things, I think we have an opportunity. So I have another metaphor, which kind of came out recently. Another person I love to follow and obsess over. So Richard Branson. And so he wrote on his blog one day that we need to end the war on drugs. And again, this is a supply and demand conversation. So in 2001, Portugal became the very first European country to officially get rid of any kind of criminal penalty we have for using drugs. So it doesn't matter if it's cocaine, heroin, methamphetamines, whatever it is, we're not going to treat it anymore like it's a criminal problem. We're going to go ahead and we're going to treat it like it's a health problem. And so he came at it from a very different angle. This is a 10-year study, by the way. And so overall, they treat it as a health problem. So you don't no longer go to prison. You get a counselor, you get a nutritionist, you get a team of providers that help understand why you're doing this in the first place. So they replaced therapy with jail time. What do we get from it? Lowest rate of lifetime marijuana use in people over 15, 10%. 17% decrease in new HIV infections in drug users. Property theft decreased 50%. So this is a stat I never knew, but 80% of all theft in the world comes from a drug problem. So who robbed you was on drugs. And then death related to heroin and other similar drugs was cut in half. They went to the user. They stopped trying to go after the cartels and the submarines that come up to Seattle filled with cocaine. They stopped going after that. They stopped trying to find the tunnels. It was a great picture. And they went after the person. They went after the demand, and the supply went away because they can't sustain. So his quote was, over $1 trillion we've been spending, and all we have is increased drug use, overflowing jails, billions of taxpayers' money wasted, and we have these thriving crime syndicates. I think this is a great metaphor. And we've been talking this metaphor for at least ever since I got here to the school. I actually did my undergraduate here, so after I escaped high school, I went to Europe for a couple years and traveled around, and I came straight here. I knew this is what I wanted to do, and did undergrad and grad here. And we've been talking this story forever. And by the way, when I present to companies, this is the slide I use. So we've been focusing our whole healthcare problem on the left side here, our little germ friend. So when there's a problem, we're going to go ahead and kill the germ, cut the organ, or drug, right? That's our intervention. But we don't even talk about the other side, the right side of the slide, which is, I love the word that he used the other day, which is resilience. We forgot about at least in the healthcare world, we forgot about the conversation about that isn't disease just a failure to adapt? Isn't disease just our bodies not able to adapt to the germ that's there in our environment? And so why aren't we working on the other side of the coin, trying to increase our body's capacity to adapt to its environment? And we all know the story. I mean, we learned the 5 factors of health here. We know that healthy nervous system was a huge piece of that, but there were other pieces of the puzzle. But nobody's talking about that side of the fence. So back to our slide. In my opinion, we have a self-contained virtual healthcare system where we can input certain programs, procedures, ideas, thoughts. We can kind of test them and remeasure relatively quickly. So think of it like a Petri dish, or many Petri dishes. So we can have a technology company, we can have a manufacturing company, we can have a retail company, engineering company, and this gets to the social factors, and we may operate differently inside of each of those companies to affect those health claims. And then all that data is coming back to our data center, and we're doing research on it. So we're seeing, just a very simple, easy example, we're seeing the effects on claims costs. Right? So if let's just take smoking cessation, for example. You notice that in your manufacturing company, smoking is going through the roof, and so then you decide to put in a smoking cessation program, and then you follow that cohort for 3 years, and you find out the quit rate and the cost on the healthcare system through the claims data. We now have proved the efficacy of that program. Does it matter if the New England Journal of Medicine published a study on how great your smoking program was? Does that CFO even care? No. It saved money. People are quitting. I don't care what you do. I don't care what you tell them. I don't care. You're saving me money, and that's the proof I need. And I feel like that's our opportunity to leapfrog. And I'm in some associations, on some boards, and there's always this call for research, call for research, call for research. We can do this relatively quickly. In fact, I'm doing it in an Excel spreadsheet all the time. So for us to leapfrog, I feel like chiropractors, other vitalistic allied providers have an opportunity to take what we're doing at the workplace now, and it's working, and literally get an exponential change in that curve and prove how we did it. whether it's through having an on-site chiropractic clinic and having everybody run through there first, whether it's through having the vitalistic philosophy in our coaching center, whatever it is, we have the 5 factors of health. We've talked about them forever. We know how to communicate them. And so if we just take this expanded footprint into the workplace, we're going to be able to affect outcomes. You can't see this. It's written in white, but there's a table there. It's basically the I'm reading it right now for you out loud. So these are the healthy behaviors and their effect on our healthcare system, and the CDC's quote to back that up. And the CDC basically said, if you don't smoke and you don't drink and we get some physical activity and some proper nutrition and diet, then we can actually curb chronic disease by 40%, which is kind of an interesting thing for them to say. We've known it forever. So I feel like we're doing that already. We know that. And having that level of thinking is what we need to inject into the place. Now, a couple slides back, I mentioned this data center. So one of the opportunities to be inside of a self-insured model, or inside of that place, who's paying the bill? The employer. Who gets the bill? The employer. Who has the data? The employer. And so we get all of that data, so we understand. I can look on a spreadsheet, and sometimes it's embarrassing because I see some of the things that some chiropractors are doing. But I can see the name of the provider. I can see how many modalities were performed on each visit, how many visits per year, overall spend, and I can compare it to what else is going on. And you know what's really cool is we're not even doing anything about this, and we're having changes. So if we look at 3-year cohort, this is the same group of people followed through for 3 years, comparing them to the rest of the population or trend, we find that people that just do an annual exam have a 7% decrease of sick leave, a 4% decrease on medical claim costs, and a 1% change on comp. And we can expect these numbers in biometrics. We know if we measure things, we can curb things, and inside of flu shots and so on. But if you do chiropractic and search for greater than 10 visits per year, we have a huge effect. And we're not even trying to. This is just reverse data. So this is data that we have from not only clients we work with, but requests for proposals that we get where they give us the data ahead of time to ask us what we would do with their population. And so we've housed a lot of data, and we're able to look at just certain trends. This down here at the bottom, one of our larger employer groups has seen a decrease in the utilization of flu shots, and we've seen an increase, and following that, we've seen a decrease in sick leave. And I'm about to get the actual medical spend number on that as well. And that's not actually going to, that story isn't going to be told just on this slide. That's going to the White House. I have the slides. I can't share them yet. But that story is going to be told. Yes? So when we look at, we have a large employer group that we work with. Over the last 3 years, I want to say purposely, we have seen a decrease in the utilization of flu shots. And when we look at the data, the performance data and the claims data, we're seeing a huge impact on that. So in other words, it's almost saying, don't get the flu shot, and you're probably not going to get sick. Levels go down. Yep. I mean, we don't have a lot of money. We don't have any investors, so we're looking at very, rough data snapshots, and we cannot wait to answer that question and start cutting up this data in different ways. And from that, it's going to develop, how we operate in that workplace. Now, we fell into this situation by accident, and there's a wealth of knowledge there. So this is the data mining story. I feel like we have an opportunity to tell a different story because we can actually see what we're doing at any given time inside a population. So to your question, we can look at if the chiropractor, and I know somebody else was talking about this, well, if we don't bill for it, how do we know it happened? That's why even if it doesn't get paid for, I think you need to bill for it because we can track that stuff. And so we can literally track number of exercise consults you had at a chiropractor and its effect on anything you want to see inside the claims data or activity data or so on. We can prove program efficacy. So if we have an initial consultation or if we have a smoking cessation program that we've created, we can now look back and see its effect on the population. Vaccinations is a big one for me. Actually, we stumbled on that. And we get to tell a different story with that data, and again, it matters because employers don't care. They need the numbers to go down, follow the money. We've heard that all weekend. So if not us, who? We're not the only ones having the conversation. We're seeing it all the time. So we're seeing a race for the consumer right now. They're setting it up with nurse lines and case managers, online care. They're trying to get ahead of this as well. What's interesting, I wrote Getty down. I probably shouldn't have. But we lost that client to somebody else who was providing a service for free. So we did biometrics for Getty Images in Seattle. And I got the phone call one day that we're no longer the provider that'll be measuring their biometrics. And so we decided to show up to the event anyways and see who was doing it. And it was a drug company. And so what's their role? And why would they want to do that? And it kind of flips me back to a conversation I had with a hospital administrator, I think it was our second client, and I asked her what her business goal was, and she said increased identification of disease state and increased utilization of our pharmacy data to manage it. That's how she knows it's successful. Those were her outcomes. So it is interesting. The company that's doing those biometrics was in it for the same reason. We want to increase the identification of people that had higher blood pressure, and we wanted a nice path to get them on high blood pressure medication. And so what did they do? They did our $50 test for free. So if not us, fast enough, this is the kind of stuff we're seeing. Digital coaching, this is a big thing. So there's a company called Health Media. I can't remember if they sold for $120 or $180 million. Either way, they provide digital coaching services for populations. And Johnson & Johnson just acquired them for a large sum of money. And Dr. Wiesold was talking about that as well. So automating the coaching experience. That's getting in front of people. And he was even talking about free models, which would be subsidized by advertising. And who do you think is going to be advertising? Right? So I feel like now is our time. Everything's sort of upside down, and we're having some great conversations, and I'm honored that I get to help share some of this. And I feel like we have a unique time where employers are completely leveraged with this problem and are listening. I love this phrase, it's the Wild Wild West. It is. We have won some large clients with a Word document, Microsoft Word document, against other companies that have $50 million in VC funding, and their proposal was bound in leather and goods and trinkets, and they've spent probably $10,000 packaging up their marketing materials, and we presented a Word document. We didn't know better. We're winning. We won. So I think we have an opportunity there. Carriers are getting on board, so we're seeing in our state, Premera and Regents. Premera has Vivacity, Regents has Vitality. So we're seeing carriers get involved in this. And actually, again, providing a free service. So I'm up against free again. There's tons of VC money here. So we've decided at the moment that we're not going to invest or take on investors because we don't need them right now, and that maintains us in control, because the last thing I would want to do is be super successful, have a lot of lives under management, 2 million is our goal, and then a drug company want to purchase us, and I have to say to a board, no, and then I get fired, and then they sell to an insurance company. So we can avoid that. Consolidation, we're starting to see that as well. So like my example, the insurance company's buying it up, drug companies buying it up. And my favorite piece of this and why I'm so passionate about it, and a lot of my friends are diehard chiropractors that are like, screw insurance, screw reform, you know, I'm doing $60 a month membership practice, and I get it. But the thing I'm taking away this weekend is that you forget who said it, is he still here? But you got to be in the system to change the system, and so by throwing up your arms like that, you are still biting and nibbling at that 10, 11, 12%, when we've got a path where there are, 80-some% of Americans are delivered to your doorstep, and you have a chance to influence them. There's a path. It's already carved out. And you don't even, I don't have any experience, and I showed up and got on that path. So it's already there. Why aren't we, running for that? And so just some specific examples that, to stimulate the conversation, maybe for questions after and maybe tomorrow. But what do we do? What can the chiropractor do? What can the vitalistic philosophy do? Well, number one is, at least for my circle of friends, and I'm not projecting this on anybody, but I think we need to get over this idea that you're not principled unless you're over a table. And our profession, seems to judge that pretty high. And I get it. It was in my backyard, and we had a student over, and I actually still practice 1.5 days a week. But a student came over and was, why would you ever want to not practice? And because I think there's different conversations we can have, and we can still affect a lot of people, maybe even more. Health and human performance consultants. So we're trying to figure out how we're going to scale and how we're going to affect this model. But you know what companies and CFOs need? They need a health and human performance consultant, maybe even on site. Or maybe a consultant takes on a book of business, and they're willing to pay for it. More than the average chiropractor makes. I've seen it. In fact, we have some coaching or some consulting clients, and it's crazy the amount of money they're willing to put at this. What if our coaches were elevated and we were able to pay them some more, and maybe we flooded the market with chiropractors as coaches? And so this is kind of my secret vision here, but this is the first person a lot of times that the employee interacts with is the health coach. They pick up that phone, and then anything can happen on the other side. The conversation can be quickly, go to your primary care, right? It could quickly be, well, let's try some lifestyle things. We have a huge opportunity to be right in front of the person, a phone call away, and affect where people go next. Something we haven't done yet and we're looking at doing is, studying the effects of an on-site chiropractic clinic. One of our clients does have a chiropractor in a wellness center, along with 2 naturopaths and about 12 massage therapists. Very forward-thinking. They tell you to go to that center first. They just had a $1 billion IPO. Really smart people, saying we need a wellness center inside of our company. I was worried I wasn't going to have enough to talk about. Now I'm running on time. So, more demand, less supply. I think the conversation needs to be interrupted right in front of the patient more often than we are. And I think we need to tell the right story. So we've been talking about it for years, but now that we have these inroads into a very incentivized, very eager channel, market, people are listening. And so it's our opportunity to tell the story. And I would even submit you can almost tell any story as long as you prove on the outcomes. And the outcomes don't have to be what we were talking about today. They could simply be decrease in medical costs, increase in performance. It doesn't have to be we prove the subluxation, and it doesn't have to be in JAMA or New England Journal of Medicine. And I feel like we are innately born with that message. We don't have to study it, pass school, or, well, that's arguable. We have that message inside of us, and it comes across. Every single patient we have that stays with us over a year will tell you. And so I want to end with how we started, because it was by accident, and maybe it will provide some, inspiration. So I graduated 11 years ago from this college, and this is actually the first time I've been back in 11 years. So we hit the ground running. I worked for a gentleman that basically had me working about 110, 120 hours a week. I was underpaid, overworked, you know the story, but it was the hugest gift I could possibly have because we were able to build a practice really fast. And after building the practice, we decided to take on associate doctors and help them get practices. And so we started a very small chain of chiropractic offices. So if you're bringing on associate doctors, you need patients. And so we started across the road. We have a Fred Meyer. Fred Meyer is owned by Kroger, for those of you who are not from the West Coast. It is now. It wasn't then. And so what we did is we went over to Kroger and we said, hey, can we do a BackSmart class? It was a marketing opportunity for us, and we said, hey, we'll just come in, we'll perform the class at no charge, and we'll get the opportunity to screen some people. So we went in there pretty regularly, monthly, quarterly, just did this free class, 20-minute class, 20 minutes of screening. We were out, you could do it on a lunch break. We did it probably for 3 years. And then, like any marketing effort that's super successful, you stop doing it, right? So we were busy, we stopped doing it, and I started getting phone calls. I'm like, wait a minute, usually I'm breaking their door down to get in there, and now she's calling me. And so I called her back. I said, hi, Lori, what's up? And she said, we missed you guys. I'm like, missed us? Yeah, right. She said, well, what's interesting is we just had our board meeting, and we're starting to trend this class, and we found out that since you've been doing our back care class, we've lost 23% of our L&I, our workers' comp claims. So reduction. And that's where the light bulb went off, and that's where I got on this track. And so by accident, but making real change. And real change that I feel like can turn into real possibility. Thank you, Dr. Klum, for having me. Thanks to Life University for having this conversation, and I welcome any questions that you may have. Other than you.
No, this is a great question. Actually, it might just be a little bit more of a story, so I apologize. Dr. White is my husband, so we work together in our corporate wellness business, and I feel like one thing that Darren is used to with me is I often tell him where he didn't quite tell the story quite good enough, so I'd like to help him tell a little bit of a story here. And on that slide with the flu shot statistic, for instance, one of the things that he didn't talk about, that is one of our biggest clients, and they have about 12,000 employees. And one of the women that we deal with at that workplace is very, very adamant that everybody have a flu shot. One of the capabilities of our program is that we have an online service where we can put things called challenges in there, and it gets disseminated to all the employees where they accept the challenge, they get points for following through with those challenges, and we have lots and lots and lots of challenges in the system. So she always requests that one of those challenges goes in the system, that we talk about getting their flu shot. And the first year we really struggled with doing this as chiropractors, and with Dr. Klum's guidance, we figured out a way to talk to this client about it. We didn't change her mind, but what we were able to do was to put in, you either get your flu shot or you do these healthy alternatives. And we talked about things like having a healthy nervous system, about eating healthy foods, about making sure you're getting your sunlight and your vitamin D, all those different things where we educated people in line with them also being encouraged to get their flu shot because the company really, really wanted them to get their flu shot. And so through that and the multiple other challenges that we put into place into the system, where we're educating people on this vitalistic philosophy of living, that every year they have this challenge and they get a lot of points for doing this challenge, and every year there's lower and lower and lower utilization. And every year there's higher and higher utilization and involvement in the other challenges that we're doing that are activity-based, that are lifestyle-based, that are making sure that you're checking your posture and all these different things that they're getting messages about living a healthy lifestyle and making healthy choices. And through that, we have I think from this year to last year to this year, we have about 1,000% increase in utilization of the total program. But as you saw in the last 3 years, we had a 22% decrease in utilization of flu shots. So it's that educational piece, and it's changing the way that people are thinking. So even though we're going through the employer channel, we're doing it to speak to the individuals, and we're talking about a different way of thinking about health and life. And that's really where that change is happening. So I just wanted to tell that story a little bit because I feel like he didn't really do it justice. And that's really where the power of the chiropractic philosophy and the vitalistic mindset really comes into play, is having those conversations and really helping people think differently about their health and where it comes from, and how to make those choices different to be healthier. So that's my question. Anything to say?